Today is 29th of May, and it's a great evening. Also, good afternoon and good morning to all those who are watching from a different time scale. TEDx Kanke is keen to bring the best ideas. Since last 1 year, we have tried our level best to bring those innovators, ideators, social activists, great personality to share their ideas and to contribute the society as possible as one can. As we know, since last 1 year, 2020, things are going in which direction we don't know. Everything is stuck up. People have no clue. And this pandemic has created a lot of distress among everyone. The question is, what to do? Is there any hope? Is there any way out to think in a different way? Life is so precious. So the main objective is to make our life fit and healthy. We also know we have lost our near and dear relatives, our friends, and other nearby surroundings. But still, we are trying our level best to help each other, to contribute, and to save the humanity. Keeping in this mind, TEDx Kanke is always keen and always eager to bring those minds, those who have contributed the society, those who have helped in their best way. Due to COVID and lot of different kind of problem, as during COVID, there are so many preventive measures. There are so many preventive and corrective measures during the COVID time, and people are also suffering post-COVID also. So for this, we have invited, and it's a great moment for TEDx Kanke, that we are having a great speaker, Dr. Garima Anandani from Mumbai. She is experienced in physiotherapy and also musculoskeletal disorders. Wide experience, more than 21 years. She is a clinical director of QI Spine Clinic, India. She is certified exercise specialist, and she has done this course from A.C.S.M, U.S.A. She has also done fellowship in Cardiac and Pulmonary Rehabilitation from Presbyterian Center of Preventive Cardiology, U.S.A. She has acquired great knowledge in spine rehabilitation from Texas, U.S.A. She had also completed the prestigious Diploma in M.D.T from University of Otago, New Zealand. She is certified Mulligan Practitioner and certified Spinal manual therapist. What more? She is expert. She is one of the best physiotherapists in India to guide us, to help us during this COVID time. What is the best remedy and how to prevent and how to keep yourself fit. So TEDx Kanke is proud to have her for his great insight. I first of all welcome Dr. Garima Anandani for his insightful session. Over to you, Garima.
Thank you, Rajiv, for a lovely introduction. A very good evening to one and all here. Today, I stand before you to present a very important topic, which is pulmonary rehabilitation in COVID-19. Thank you, Rajiv, for inviting me and TEDx Kanke for giving me this chance and opportunity to be among all of you and present my idea. Some of you are aware of the importance of pulmonary rehabilitation in COVID recovery. And those of you who are wondering what is pulmonary rehabilitation, Pulmo stands for lungs, which means today we are talking about lung rehabilitation. COVID has impacted us in many ways. Globally and in India. Physical, mental, emotional, and financial. So what is the problem we are dealing with? As people recover from COVID, during and post, they may face respiratory issues, musculoskeletal issues, and some others may face some neurological, cardiac issues, and some other issues. Impaired lung function or breathlessness post-COVID is one of a common sequelae. Fatigue, weakness, inability to do your activities of daily living to the level which you were doing is also observed in post-COVID recovery. Lung fibrosis or pulmonary fibrosis is the most common sequelae after COVID. So before we dive down into our topic, let me share a little story about myself. Thanks to the push from my mother, I reached KVS national level swimming competition and won a silver and a gold medal during my 10th grade. It was my mother who has always inspired and pushed us to do better every single day. My mother wanted me to be a physical therapist, a doctor, and I followed her dream. In my final year, I wanted to change my stream, and hence I gave my CAT exam, got through MBA, and got through Tata Institute of Social Science, the prestigious institute in Mumbai, their Masters in Health Administration program. It was my dad who told me, be the best. I followed his advice and pursued my master's from All India Institute of Physical Medicine and Rehabilitation. It was a turning point in my life. Do what you love or love what you do. I decided to love what I do. At AIPMR, my mentors questioned me why, what, how of everything. And this led to a foundation and impacted the way I think. It rewired my brain as a physical therapist. April 11, 2021 was a transformational learning experience. I was not expecting it. I got shock of my life when I was tested positive for COVID. Being from the medical field, And having taken both the doses of the vaccine, I thought I was safe. Having lost people I knew during second wave was already playing on my mind. I had a choice: help myself or depend on external help. At this time, I digged into my own knowledge of being best and worked in the best hospital in India and abroad. During my fellowship, I had treated patients in the pulmonary rehabilitation program at the Presbyterian Institute in New York. Plus, having worked at the Asian Heart Institute and treating patients for 5 years, I knew what I had to do. At this time, I started doing my deep breathing exercises, my abdominal exercises, my diaphragmatic exercises, incentive spirometry, arm and leg exercises. Now, these are very small components which help me to regain my endurance. 1 week later, I was stronger, energetic, and determined. I realized if I could help others and started doing Sunday workshops to help spread the awareness of chest physiotherapy and pulmonary rehabilitation in COVID recovery. We helped more than 3,000 plus patients through these workshops. Here's my motivation to impact the lives of people affected through COVID. I met Sujoy. Watching him not getting enough physiotherapy due to load on the hospital further added wings to my mission. I request Rajiv and the host to play the video at this point.
Is the video is visible? Then
Yes.
I will play the.
Yes.
Hi, I'm Sujay Sinha. I'm a COVID recovering patient, and I've been under Dr. Garima Anandani for past 10 days for physiotherapy and rehab. In the past 10 days, I have made significant progress in my health, in my breathing, and my message to all the COVID recovering patients is that medicine will be able to cure your or kill the virus, but to rehabilitate into your day-to-day life, you need active physiotherapy so that you can perform your daily chores as per your pre-COVID requirements. Hi, I'm Sujay Sinha. I'm a COVID.
So that's Sujoy. He's recovering, and we see every day more improvements. Like I mentioned, seeing him has only added wings to my mission. Thank you, Sujoy, for being proactively participating and giving me this opportunity to present your view to everybody. So what is pulmonary rehab? It is a program of exercise and education to improve lung capacity and recover faster. Who should do it? Prepare yourself for multiple waves and improve lung function. So anybody who wants to prepare themselves should do it. Mild, moderate, severe cases of COVID, post and during, should definitely do it. Those who have had lung diseases before, example, asthma, chronic obstructive pulmonary disease, bronchitis, and emphysema. These are some of the chronic lung diseases which may require pulmonary rehabilitation on an ongoing basis to breathe better and live a better quality of life. Why is it important? Pulmonary rehabilitation will help in large and significant improvement in your exercise endurance and ability to get back to your activities of daily living. For example, going back to your work, cooking, walking, running. It reduces breathlessness and improves lung function. It will help in improving your recovery faster and reduce disability, hence resulting in a better quality of life. How is pulmonary rehabilitation done? It can be done in isolation from your home while you are isolating because of COVID. It can also be done from the hospital. Minimum of 3 to 5 sessions a week are required, and 6 to 8 weeks for minimal to moderate patients, and for severe patients, it can go up till they get back to function. Pulmonary rehabilitation starts with a basic assessment, a 6-minute walk test. It can be done at home using a simple oximeter, measuring your blood pressure if required, monitoring your vitals. Patients are monitored on a BOG dyspnea scale or a modified exertional scale. It's a scale on 0 to 10, and it guides the activity level to which you can actually take the patient to. So to give you an example, 9 will stand for very, very severe breathlessness. And 0 means no breathlessness at all, or no tiredness while walking. So the pulmonary rehabilitation program has the following components: breathing techniques, pacing techniques, how to make sure your breathing becomes easier when you are tired, body positions, which is commonly referred as proning, building strength, example, aerobic, walking, cycling, simple graded manner of making sure that your aerobic capacity is increased. And most importantly, patient education and mindfulness. As we know, the awareness about this concept of why it should be done and how will it help is very, very crucial. So today, TEDx Kanke chose this topic, and I am happy to deliver it, and I will reach as many people as possible, and I would like all of you to join me to spread this message to those who are in need or who may need it in future. I invite you to share it with your family, friends, and people. We did a small survey, and the survey revealed something very, very interesting. The survey is ongoing. I'm just going to share some preliminary findings from my survey. The survey was done on COVID patients who were either hospitalized or were in home isolation. And what we found was as many as 55% patients did not know the role of physiotherapy and rehabilitation in recovery from COVID. That's the first finding. Second finding, as many as 30% patients faced breathlessness 3 weeks post their recovery. So they had recovered from COVID and it had been 3 weeks and still they were facing breathlessness. The third important finding we found was 45 to 50% of patients faced anxiety and depression during and post-COVID recovery. The fourth finding is as many as 35 to 40% of patients had no clue that they needed physiotherapy in their recovery, and 30% of the patients only had received physiotherapy during their hospital stay or in home isolation. While this journey continues, I'm reminded of my mentor who told me, focus on building more Garimas. And today, we are 55 of us in the live talk. And let's ensure that this message reaches out to people who need to know about this. You can join us in the following ways to help us in our mission. The Sunday workshops, the COVID recovery workshops to help spread the awareness. A COVID recovery and rehabilitation hub, which is a Facebook group, which has currently 300 plus members. You can join that group to keep a regular update about what is happening. You can get some live insights. You can also get some ideas from us on how to do your breathing exercises. A tele-lung rehabilitation program from home can be done from comfort of your home through Zoom under the guidance of the team. A typical pulmonary rehabilitation program has a physiotherapist, has a doctor, has a physiotherapist, doctor, pulmonologist, and yourself. If you wish to get a free ebook, please do write to me at this email ID, where we have put a short rehabilitation guide to help people who are on their own to get the right guidance. You can follow me on social media. Last but not the least, I would like to thank all my well-wishers, my family, and my friends who have been instrumental in my journey to where I am today. Thank you for this wonderful opportunity, and all those who could be doing anything else on a Saturday afternoon, but decided and chose to be here. And I wish that you will be helping me spread this mission, reach to people who need it. Thank you. Rajiv, over to you.
Extremely thanks, Dr. Garima, for this insightful session. I think we all have learned and got confidence and the importance of this pulmo organ. Before 2020, if I do remember, very few might have aware of this pulmonologist and pulmonary organ and the importance of it. Due to Corona and this crisis has given a chance to know the power of this pulmo organ, what is called lungs. Lungs is basically a gateway of our human body. What you breathe in and breathe out, the major function by lungs is most crucial. As you also told, apart from medical and from medicine treatment, it is most important to do preventive and even post-COVID. Exercise is one of the key elements so that you can strengthen your pulmo organ or you can strengthen your lungs. As a physiotherapist, you might have come across different kind of clients, patients, and people. One specific that it actually touched you is somehow if you can educate that person, it could be a great help to him, and just a small therapist style and activity, he or she can improve their health. So this is the beauty. What's your view on that? The power of physiotherapy in this lung therapy. What do you say on that?
So Rajiv, like you rightly mentioned, pandemic is here to stay. We don't know. When the first wave came, we thought, we are almost done. And then the second wave. And now we are hearing the third wave. We don't know. The multiple waves may come. But what we know is what is in our hand. So everybody knows what they need to do to get thin, don't we? Right? Eat right, burn your calories. Now, what can we do to make sure that if need be, our lungs are able to cope up with the strength, what is needed at that time if you get infected with the virus. So pulmonary rehabilitation or strengthening of the lungs, like I mentioned, it's a full program. We have to ensure that we are correcting the breathing pattern of the patients. What is seen is that typically the breathing pattern will get affected and the patient is not able to control his breath. And he involuntarily is either going too fast and he's not able to go in a very slow and easy manner. So simple activities like going to the toilet, eating your own food can be a task. So even simple things like just lifting your hand makes you breathless. So during that time, your task, rather than learning new things, if you have already invested your energy to learning to breathe in a right manner, to strengthen your lungs, and strengthening does not just happen with simple breathing exercises. It requires a graded exercise program. So you start with simple basic exercises, you progress. So while I was in New York, North Carolina, and I was part of this pulmonary fellowship, pulmonary rehab, we almost saw, Rajiv, patients on 7 to 8 liters, sometimes 12 liters of oxygen running on a treadmill, cycling, and doing everything they need to make sure that they don't feel breathless in their activities they wish to do. Portable oxygen is the way they would deal with it while they had to come and go out from the centers. So in short, it's a graded exercise program. And not only exercise, you have to make sure patient education, mindfulness, learning the tricks to help your mind cope up when you are in that situation.
That's very important what you have told, that physical exercise and physical activity will certainly help you. And this is actually we all have learned. But there are lots of things, lots of myth also during this pandemic time and during this corona time. People, those who have suffered from COVID positive and they have recovered, even after recovering 10-15 days, they're having post symptom like having some breathlessness, some oxygen level fluctuating, even BP fluctuating also. So they have no clue why this thing is happening. So post COVID, What would be your suggestion for all those patients or for all those persons, those who are still suffering and having no clue what to do?
So once you get discharged from the hospital or once you are tested negative, that's not the end of the journey. In fact, the road to recovery continues, which means you still need to be in touch with your doctors, physiotherapists, and pulmonary rehabilitation specialists to ensure that these small things are taken care of. The doctor will take care of the medical part, which means he will make sure that your blood reports every few weeks are tested and they are coping up the way they should. The physical therapist will ensure that you are moving from step A to step B to C, and eventually getting back to where you were pre-COVID, and even in a better situation, because if a third wave may come, better to cope up and prepare. So, and third, be in touch with your inner self. Ensure that you are taking time out, improving your mental state, taking help if required from the psychologist, doing regular meditation, yoga, and most important, learning to be calm and composed in whatever situation comes around.
You are simply saying, Dr. Garima, acceptance first of all, as the pandemic and during the pandemic and post-pandemic also, or post-COVID also, whatever experience you have got, accept it. Just try to keep it with yourself, get all the treatment and move ahead with the positive note. But there are a lot of people, those who have suffered, they have lost their family. So whenever they are getting any news and information, when post-COVID situation, what is happening, their oxygen level is coming down, their BP is fluctuating, and they are in a panic mode. They're in a panic mode. So at home, post-COVID, when they have come back to their home and just having some small medicine and some small suggestion from doctor, as a physiotherapist, which is very important at home, what should be done? What should be done, and what suggestion you want to give to those people now resting at home and recovering from this COVID time? What's your specific and how to do it? Basically, how to do it? Because there is a myth also. Just I'm just once again I'm correcting my statement. There is a myth and kind of thing. Just post COVID, you don't do any kind of exercise. So how do you correlate this exercise and physiotherapy?
So, a lot of people are, like you said, it's a myth that do not do exercise. Okay, that's correctly called a myth. You need to start doing exercise in a measured way. And only way you know your capacity is to test it. A 6-minute walk test can be done at home. It's a very simple tool. You put a timer on, you take your SpO2 before you start, and ensure that you're monitoring your oxygen throughout your walking. It can be done from one end of the house to the other end, and you start walking and you test your oxygen. While you do that, if you start feeling breathless and your oxygen starts falling below 92% or 91%, sit down, relax, again, catch your breath, and again start. If again this persists, then stop and speak to a doctor, speak to a physiotherapist who's knowledgeable, who knows about this, and help them take guidance that I am getting breathless even during my 6-minute walk test. So what is the level should I start at? These are people who will need guidance, and we should not try to do everything on our own. If today I am standing here and made such a beautiful presentation, the question is, I'm a doctor, right? I'm not a specialist in making presentations, but people who support me help, right? They're specialists in this, they help. So I'm a specialist in my field. So let the doctor, the physiotherapist take their call. Do not make Google University. Do not make WhatsApp University your go-to choice. Ask the experts, take suggestions. But if you are 6-minute walk test is okay, start with simple walking in the house 2 or 3 times in a day, 5 to 10 minutes, depending on your tolerance, and slowly keep increasing it. And let's ensure that oxygen is being monitored, not just once your test results come negative, but also post 3 to 4 weeks minimum, you're monitoring your oxygen. In case of any event, you're able to report to your doctor soon enough. Also, regular checkups to your doctor cannot be skipped. So the pulmonologist or the treating doctor will ask you to do reports every few weeks. That must be done and reported back to him, and ensure that any vitals or any other parameter which needs to be corrected is being done. Simple exercises like breathing exercises, arm and leg exercises can be started. However, like I mentioned, pulmonary rehabilitation program can be done under professionals from the comfort of your home. So reach out and ensure that you get the right guidance. Please do not rely on your only source, which is Google University.
Very, very true. So I request all the participants also. So if you have any question, I will connect you with the speaker so that you can directly ask your question and query, and our speaker will answer on that. Just I'm asking one last question from my side, then session will be open to all participants. You can just put your hand in the chat box that you are willing upna, so my IT team will just unmute you and you can directly ask the question. Garima, I just want to know, during this pandemic, a lot of CT scan of chest was done. And as a common man, we had no idea whether 6 out of 25 or 10 out of 25 or 15 out of 25 people and doctors were saying there is an infection, there is a COVID pneumonia, there is a different kind of thing. So treatment was done. Patient recovered. But for a layman, how much time it will take to recover the whole lungs function when you come back to home, and when you are infected, your lungs, whatever measures as doctor told through CT scan, what's your view on that? How much time it will take? 2 months, 3 months, 4 months, and what precaution is required at home also?
So let's just understand, a CT scan is actually like an image of your lungs, right?
Yeah.
Is it a functional test?
Yeah.
Any idea? Is it a functional test? Can anybody answer that? Is CT scan a functional test?
I think you explain it up now. People must be aware, but I think you should explain it.
So CT scan is not a functional test. Functional test, if I was to give you an analogy, everybody knows stress test, right? If we are suffering from a heart condition, there are 2 things which will happen. You will be asked to do an angiography, which is like an image, and you will be asked to do a 2D echo and a stress test. A stress test is a functional test. They make you run on a treadmill and see how tired your lungs are becoming, how tired your heart is becoming. Similarly, in case of lungs, CT scan is not a functional test. To be able to say that whether my lungs, how long it will take, or whether they have recovered completely, we need to find out doing a functional test. However, during COVID, you will not ask, or post-COVID for some time, you will not be asked to do a functional test of the lungs, which is called a pulmonary function test, PFT. It is used for asthmatics, COPDs, few other conditions to measure how strong your lungs are and how much can they cope up. During this journey, you will not be asked typically by your doctor to do it. So what can you do from home to understand whether actually your lungs are recovering? So CT scan will not be advised possibly by the doctor again, unless there is some indication by the doctor. So if you know that at the end of 3 weeks or 2 weeks, you could walk or run, say 5 minutes. After another 2 weeks, you're able to do 10 minutes. Another 2 weeks, you're able to do half an hour, and so on and so forth, till you reach 1 hour, 45 minutes of your usual capacity. You know your lungs are recovering, because to be able to do those activities, your lungs need to be stronger. They need to be functioning well. So as a layperson, you would have to rely on your walking ability, doing your day-to-day ability of function. You'll have to rely on that. And then if the doctor needs a test, he will order it.
Very, very true. That's very important, actually. You know your strength, you know your inner strength. So just keep trying, and then you find yourself that, yeah, slowly, you are recouping and you are recovering, and your strength is also increasing. So now I have a good friend, Mr. Chandramohan Chug. He has a question. So I request Chandramohan Chug, sir, kindly unmute yourself and put your question directly to Dr. Garima.
Okay, so good afternoon, Dr. Garima. It was a wonderful session that, and it's really, it would go a long way in making people aware of all those issues that you raised, the topics, or even the awareness about this particular rehab program. So my question actually is related to that only. What we have, as a layman, we hear all kinds of things. One of them is COVID has, at least for old patients, let's say in late 70s or early 80s or something like that, it has made some kind of caused a sort of a permanent damage. So when I say permanent damage, I would mean if the person, let's say, has an SpO2 level of say 97, 98 pre-COVID, now it is saturating at a level of say 93, 94, or maybe less than that. So, of course, as you were rightly pointing out, it would mean in compromising the life quality to a great extent. You can't even walk to the even washroom, right, or raise a hand. In fact, if the situation go even more worse. So I would like to know, for the benefit of everybody, whether it is really permanent. Can it be brought back to those levels? To what an extent, and how do we do it? And my added question to that, of course, is something to do with the people, let's say, who are chronic, let's say, smokers. I think they will have similar kind of an experience. I mean, to my understanding. As I said, I'm not a doctor or in the medical field. So, what kind of a regime could be adopted for this rehab, preliminary rehab? Thank you.
Chandraji, thank you for your question. So first of all, the infection could be mild, moderate, or severe, depending on how much your lungs got affected. The recovery time may vary. And it also depends on the events during your ICU stay or during your hospitalization stay, which means many of those patients who got hospitalized, who needed ICU stay, some of them may have had lung damage, which cannot necessarily be permanent. It's basically called as pulmonary fibrosis. And not, like I said, unlike in COPD, unlike in others, some of the lung conditions, a lot of it is reversible. However, every patient is different, and events in the hospital may determine your recovery. But having said that, pulmonary fibrosis in COVID, unless it is, some event has happened in the hospital, it's generally reversible, which means you need to get back the elasticity and the strength of your lungs back by doing a graded exercise program. And as you do that, you will be able to get back to the quality of life you had either pre-COVID or even better than that. So when I say, the second point you asked is if you are a smoker. So in smokers and in other lung diseases like COPD or asthma, the lung function gets compromised because of the diseases. In smoking, there's a lot of damage which happens to the lungs, and doing a pulmonary rehab program can be absolutely beneficial But at the same time, what is crucial is that you stop smoking. So if we see in whatever damage we are doing to our body, right? Whether it's breathing up polluted air or smoking or not doing the right form of exercise or not enough. Maybe I say, okay, I exercise, but I'm just, doing say 10 minutes or 20 minutes. May not be enough to strengthen your lungs, to have a better quality of life or to cope up in any event which may happen. So it's a journey and it needs to be traveled. Like you already mentioned, there is a requirement to spread this awareness, and we just need to keep adding. Each one of us need to start contributing towards spreading this awareness so that people can have a better quality of life.
You have rightly said, Dr. Garima, that awareness, education, and plus exercise, what you are suggesting, that exercise in form of physiotherapy, it's very important. And we all have learned or got experience during this COVID time. And I don't know how long it will continue. We have no idea, no clue, third wave, fourth wave, we don't know whether we need to be cope up with this kind of virus, but how to enhance our immunity, which is most important. And what we have seen this time, not only lungs are being affected, there are other organs in the second wave. I have seen few friends, those who have acute pain in a spine, lower back spine, stomach pain, different kind of fever also. So for spine therapy, because you are physiotherapist and you are just helping us to utilize this thing. So how to work on a spine or to make a spine more flexible and more stronger due to this corona? What's your view on that?
So the COVID virus can impact many organs.
Yes.
So lungs is just one part of it. So while you are undergoing the rehabilitation, due to proning in the hospital, 10 to 12 hours of proning, a lot of patients develop neck pain, back pain, sometimes arm pain, and a lot of other joint pains. That's pain. Apart from that, long stay in ICU can result into what we call as an ICU syndrome. Basically, weakness all over your body, sometimes resulting also in a neurological sequelae. What that means, that patient may face some kind of paralysis. Sometimes we've also seen patients get heart attack. Now, whether it is because of COVID or as a general history they had, that's not my expertise to determine. However, if they are facing any pains and aches post the recovery, they need to work towards it, and they need to find some pain to cope up pain. You can take painkillers, but they are very, very temporary. They do not give you relief beyond a few hours. So to remove pains and aches, we work on method called as the McKenzie method or the M.D.T method, for which I've been trained in my university. And we give you exercises, movements, which can help you recover from your pains and aches much faster without physically visiting us through online consultation or video consultation. So nice of you, these pains should be attended to, should not be ignored. And apart from that, if you're facing any other issue, you should go back to your doctor and ensure that you are taking care of the medical part. If there's any medical condition that requires attention, you're going back to him.
So nice of you. Now we have Mr. Jayendra Grewal. He has question to you, and I request Jayendra sir kindly on your video, and you can directly ask question to Dr. Garima. Over to you, Mr. Jayendra.
Good evening, Dr. Garima. Dr. Rajiv, and all the participants on the show. First of all, I would like to thank you for doing a great service to the humanity under this present conditions when our country is facing this pandemic. And all you doctors and frontline workers, you are also under great duress, and you have taken time to take this presentation. So my question is, since I have understood the importance of the pulmonary rehabilitation, so what are the breathing techniques which are required for this rehabilitation? For that, you will be telling us now, or that book which Madam has written, that will be sufficient, which we can receive on our email.
So, Jayendra ji, first of all, thank you for asking the question, the right question. Book is a guidance, a guidance to you which you can refer to. However, it may not replace the guidance which we can offer you. So, if you are suffering and you feel after reading the book you still need guidance, please feel free to write to us, and we will. If you be part of the Facebook group, we keep posting the live videos on how to do these breathing techniques. If the patient has suffered moderate to severe COVID, he may require ongoing guidance to ensure to learn these right breathing techniques. Because what happens is, let's say I taught you, and if I can just give a demonstration here, if I was to teach you, say lateral coastal breathing, okay, lateral matlab chest, lateral side of the chest, and I tell you, let's start, okay? So, now, when I do this, what did I do? I took breathe from my nose and blew out from my mouth through pursed lip breathing. Pursed lip breathing is an important technique which is helping us improve our lung capacity. Now, there are various small techniques. In the book, it's a short ebook for guiding you. We have mentioned some of these things, but obviously it cannot replace what guidance you can get face-to-face or by joining the program. So definitely, please write to us for the ebook and join the Facebook group and listen to our live shows so that you can get guidance. We also post our live class video on that, so you can go through that as well. And if you wish to join, you can come back.
Thank you.
Thanks, Garima, for this wonderful suggestion. I think Jayendra will get this help from this suggestion. Now we have Mr. Karthikeyan Aru. He wants to ask question. Karthikeyan sir, you can please ask your question.
Yes, doctor. Good evening, doctors. Thanks for a very useful session on pulmonary rehabilitation during this pandemic period. Thanks to a very good session. Really, I enjoyed this. I have a few doubts to be cleared. I request you to clear this. I have been working in an ICU hospital in our hometown. We frequently face patients getting fainted during while they go into restroom or toilet. Also, a few patients during their exertion, even for a slight walking also, they used to fall suddenly. Can you give a few suggestions to cope up with this kind of situations? Thanks a lot. So,
Mr. Karthikeyan, what is the capacity in which you are working in the hospital? What's your role?
I am working as a physiotherapist.
Okay, great. Very happy to be part of this. So, the reason a patient may faint, okay, there could be various reasons. However, measuring vitals before you mobilize a patient is very, very critical. So, for example, if a patient has been lying down on the bed for a very long time, and then you make him sit up and, go to the toilet, the blood pressure may suddenly fall, right? And because of weakness, they are anyways weak. So, monitoring the vitals before you mobilize a patient, before, during, and after is very, very crucial. Understanding whether the patient is even fit to go to the toilet before you actually mobilize them, right? So which means that you cannot, after they fall, it's very difficult to control anything, right? So you determine using your analysis, using your own assessment. This workshop is mainly for the general public, but to physiotherapists, we can explain more in detail if required. But you need to check the capacity of the patient, measure the vitals before you mobilize them. And apart from that, check out for any other complications, check out their x-rays, talk to the pulmonologist whether they are, is there any medical event like you need to be aware of before you mobilize. So the only reason, if you do not do what I said before and you start mobilizing, you can face this issue that patient has suddenly fainted.
Okay, doctor. Another doubt I am having, doctor. Most of the COVID patients, I am mentioning severe COVID patients used to die during morning 3 to 5 a.m. Is there anything, something related to this?
Well, I have also read these reasons, but it's not my expertise, so I wouldn't like to answer that question. But yes, I have also read that. I may not be the right person to answer that.
Okay, doctor. Do you have any graded exercise program? Anything ebook for our fellow physiotherapists to follow in India for COVID rehabilitation?
So well, I'm also from India, and I'm situated in Mumbai. This book, which we have put, that's mainly for the patients. We have not come up with an e-version of which can be followed by the physiotherapist. But I take your suggestion, and we'll hopefully in future come with something which you can use. Or if we are conducting a course, we will definitely invite you.
If you do so, you will be so much privileged, doctor. Thank you. Thanks a lot.
Thanks, Karthikeyan, for your wonderful suggestion. Also, I think together we can create an ecosystem and a platform that this pandemic will go, and we all will live in a happy mode.
Yes,
there is a
sure.
question in chat box, Dr. Garima, from Sweta Tarat. And her question is, how do we customize pulmonary rehabilitation according to mild, moderate, and severe affection of lung? There are three kinds of infection: mild, moderate, and severe. So how you will suggest as a physiotherapist?
Can she come on the screen so we can understand? Is she a doctor? Is she a patient?
Sweta, can you put your question? Yeah, Sweta is here. Yeah. So
yeah, Shweta.
Unmute
Shweta,
her.
are you from the medical field?
Kailash, kindly unmute Sweta. Just a minute. Kailash, kindly unmute Sweta. Yeah. Yes, Sweta, you can ask your question.
Good evening, ma'am. I am a first year postgraduate student studying cardiorespiratory sciences. I'm a physiotherapist myself, and often we have been seeing cases where on CT we can differentiate if the affection is mild, moderate, or severe. So there's a set protocol for pulmonary rehab already out there, but sometimes it becomes very difficult to customize it because it has to be individualized. So what would you suggest? How would you guide us or me as a physiotherapist regarding the protocol?
So are you talking about hospital or home isolation?
Hospital specifically.
Okay. Now, each and every hospital have their own protocol. So being part of the system, a lot of times you have to just follow the system, or you may be courageous enough to change it. But lots of times you have to follow what your seniors or what the hospital is following. So first of all, typically people who stay, minimal patients don't come to the hospital as much. They are put through home isolation. So we are here talking about moderate and severe patients who had a drop in their SpO2 levels, because of which they were rushed to the hospital, and hence you are seeing them now. Now that before I answer your question, how much time do you get to spend with a patient in the hospital?
Around 20 to 30 minutes.
Okay, that's actually a good amount of time. In some hospitals, because of the load, even lesser time was being available, or no physiotherapy was the problem. So that's excellent, Shweta. Which city are you from?
Pune.
Pune, great. So during 20 to 30 minutes of your time, you have to divide your session into making sure what the patient's problem is. So standard protocol, breathing exercise, you did some breathing exercises and you came back, may not be the right thing. So identifying what is the patient's problem. So let's understand if the patient had breathing problem and now his breathing pattern has got affected, which means when you want him to do inspiration and expiration, the cycle has got reversed and he's not able to control it. Then your time spent on the patient has to first be on correcting that breathing pattern. Same way, if you are dealing with somebody whose pattern is not a problem, but problem is that his endurance is the issue. So yes, you will teach him the techniques, you will give him incentive spirometry, but he can manage this part on his own, and you can focus on building endurance by doing arm, leg, whole arm body exercises according to what he can tolerate. Monitoring patients' SpO2, VOG exertion scale is very, very critical. Making the patient educate and ensuring that he understands why he's doing what he's doing. And empowering the patient can be very, very useful strategy. And deciding आप क्या करेंगे उनके लिए, वो खुद क्या करेंगे अपने लिए. So for example, you are going to go to him, say in the morning. In the evening, what he should be doing in the afternoon, whether simple things like blowing balloons, spirometry, moving his own, you have to divide it. Your time should go into what you can focus on helping him with. Things which he can do himself, you should leave it to him and guide him to do it. So severe, if a patient is very severe, you will have to obviously like on ICU, if he's in ICU and he's on ventilator, you'll have to do your percussions, body positions, and if required, chest physiotherapy.
Okay, ma'am. Thank you so much. And how do I go about if there's home isolation? This was regarding hospital, but if there's a patient who is on tele-rehabilitation, so how do I go about it?
Tele-rehabilitation requires a certain skill, which because you have to monitor the patient remotely, right? So Shweta, if you do not have the experience, I would just say you get that experience. We are conducting it. So if you feel that you would like to learn, maybe not immediately, but as and when we are able to do something for the physiotherapist, we will invite you.
Thank you so much.
Thanks, Shweta, for your this question. Now, I would like to request, we are having Mr. Sunil Sinha, sir, if he can unmute and just say a few words about this session. He's a great person and great well-wisher of this platform. Sunil, sir, if you don't mind and if you are comfortable, can you unmute, or Kailash, can you unmute Sunil, sir, so that he will share a few suggestions. Sunil, sir, are you hearing me or are you hearing us? Now, as the time is very less, we will take one or two questions or yes.
Oh,
Sunil,
sure. Just give me half a second. I will definitely talk about it.
Yeah.
This is absolutely wonderful session, I must say. So, am I visible?
Yes,
I don't know.
Yeah, you're visible, audible, clear, sir, clear and loud.
Thank you very much. First of all, thank you very much for inviting me to speak a few words. And, it's very difficult to say anything about Garima. She's a wonderful physiotherapist, and I've been working with her for last over 10, 12 years. And she's definitely the best we have in India. And today's session was so apt. Today, so many people are suffering from this unknown virus, and we need to democratize the knowledge about how to deal with this situation. And I think Garima has done a fantastic work in sharing how you can improve your lung capacity to deal with this problem. And many people are facing, will face, have faced this kind of problem. So my sincere thanks to all of you for organizing this, and my thanks and compliments to Garima Anandani for not only giving a very good input, but dealing with the questions in a very, very nice manner. And I think with this kind of discussion we should keep having, and maybe at some other point of time we should again invite Garima to talk to another set of audience, because the kind of knowledge that she has shared is absolutely invaluable in today's environment. Thank you very much, and all the best to you.
Thank you, sir, for your suggestion and your confidence and your showing blessings. So we are very grateful that you joined and you told a very good word about her experience and everything. So together again.
No, and kudos to Ted Kake. You know, you guys are doing such a wonderful job. This kind of conversation you are having and getting people connected on a virtual platform. This knowledge sharing is absolutely invaluable. And hats off to you for organizing this. Keep doing it. And whenever you let me know, I'll be very happy to join.
Thank you, sir. Thank you. And as we all know, sir, due to this COVID and Corona time, people are talking about, all the medical doctors are saying physical distance, social distance, but we all have come together, social togetherness on this digital platform. And that's the beauty. People from all across the globe, we are talking about humanity, we are talking about health, we are talking about fitness. So many good things is happening. So these are the positive outcome, and we should not forget all that losses and all that situation that we all have experienced. But at the same time, this is the beauty and lesson of life both at the same time. We are moving
absolutely.
Ahead.
And unfortunately, we are bombarded with so much of negative news on televisions and social media, because that sells. So this kind of positive news is really, really very invigorating.
I totally agree with that, sir. So whatever situation is there is always a good people and a few innovative people, those who come forward and just take a lead to bring right people and to connect the right people with the right community. So I'm very fortunate to have Dr. Garima for this session. Very insightful, very educative, and we all have learned, and also we have got confidence. Yeah, after post-COVID, there is always a good hope that slowly we can build our strength. And pulmonary is one most important organ which somehow we had no idea due to COVID time, that we all have come to know that this is the powerhouse and this is the gateway of our human body. We need to keep it fit and fine. One last question I want to ask from Dr. Garima. What is lungs fibrosis and how it affects our lung? So is there any way out through physiotherapy to strengthen our lung if a patient is affected through lungs fibrosis?
So what is during the infection, which is pneumonia, when the COVID patient gets affected, his lungs, when they are suffering because of low oxygen, they go into what we call as lung fibrosis. And this lung fibrosis makes our muscles very weak, and the capacity to breathe and walk reduces drastically. As I said, depending on what percentage and events during your hospital stay, you will be able to reverse it. But obviously, in guidance with a pulmonologist, physiotherapist. So we are talking about an entire team. We're not talking about only physiotherapy here. So I would like to take this question to make you understand. We are not just talking about physiotherapy. We are talking about a team of specialists, which is a physiotherapist, a doctor, yoga therapist, and a pulmonologist who can deal with post-sequelae COVID recovery symptoms. So pulmonary rehabilitation will help them recover, and it will also help them get back to their activities of daily living. As I said, depending on each patient's own recovery, some patients will recover completely. The time variation may vary. However, many patients may need ongoing rehabilitation or oxygen for a long time. Raji?
Yeah. You have rightly said, Garima. So there is no doubt, yes, pulmonary organ is most important, and we all need to know. And yes, today we have got a good amount of knowledge how to strengthen it, how to make our this organ more fit through consistent effort. So I think this is a great session, and we all are very excited, delighted to host you and for this wonderful session. The whole TEDx Kanke team is grateful for this amazing, insightful session. I hope all my participants, those who have joined from India and across other country, so they must have seen, yes, pulmonary organ is so important, how we can recoup, how we can revitalize and to rehabilitate in such a good way. So not to be in panic mode. There is always way. There are always a good people, and I think together we can just take it forward. So TEDx Kanke is again keen to bring the best ideas. We have started small. We are working together to just bring the right people to the right stream and on the right platform, so that together we can have more amount of knowledge and more amount of education from different stream. So just one last question. I think someone asked to ask any question. Ms. Sobha Ramchandani, if you have any question you can ask, then we will just close this session because the time has already crossed 1 hour. So Ms. Sobha Ramchandani, if you are tell us, can you unmute Sobha, because I want more question from all the participants. That is the beauty and that is the purpose, so that we all will be benefited.
Hello. Hi, Doc. Can you hear me?
Yes, sir.
Yeah,
actually,
hi.
your name was written Sobha Ramchandani.
Yeah, no, it's my wife's, login. So logged in through that. Thank you so much for this insightful session. It's been a huge learning, and I'm sure it will help all of us. Actually, this pandemic has been very difficult for a lot of colleagues in office, for a lot of friends, family, in society. I was wondering, is there any way, if such group sessions could be organized in office or in, a society for the benefit of other people? If so, how do we do that? In fact, I work for an organization which has branches across Delhi and all other places where medical facilities have been very difficult to find. So it's, it'll be great if, we can organize these, group events for friends and colleagues or office colleagues.
I think it's quite possible, and Dr. Garima is always approachable and accessible with all her links and with her contact also. So professionally sitting all kind of session, and she's connected with QI Spinal Lab from India, and it has many centers all across India also. So you can check, and Garima will also share her contact to you so that you can communicate.
So Raji, Raji, may I say something here?
Yeah, please, Garima.
So in fact, we have been conducting Sunday workshops, free Sunday workshops to spread awareness Also, while we were doing these Sunday workshops, a lot of people what he said, we have had inquiries from corporates, and we have already started doing corporate sessions where we are doing group sessions for their office and holding group sessions for pulmonary rehabilitation in groups. So you can reach out to me. I have written my email in the chat box, and also I'm contactable on my social media links on Facebook, YouTube, and I will share my links. If you have left the email ID with the organizer, I will get in touch, and you can anyways email me, Dr. Garima Anandani @gmail.com. And yeah, my links are being shared on the chat box. So anybody who wishes to contact for doing workshops or spreading awareness in their society, please do get in touch. Also, those of you who wish to join the pulmonary rehabilitation program, which we are running in the last, we have started it last month, and it is done by a group of professionals, and it is there 8 to 9 in the morning and 5 to 6 in the evening. You can join those sessions for the guidance and do it along with the experts. So hold workshops, join for one-on-one session, or do group sessions. All is possible. Please do get in touch.
Yeah, thanks, Mr. Ramchandani, for your suggestion. I think Garima will certainly would be happy to help your community and your team members wherever you are. So once again, I thanks to all participants, those who joined and interacted with our speaker. A special thanks to all my friends, those who directly asked to the question, Sunil sir, Mr. Chug, Mr. Jayendra, and Mr. Kartikeyan, and Mr. Ramchandani. You have asked question directly to Garima. I think we all have been benefited. This conversation has given a new dimension to see the thing, what is happening, and how to overcome, and how to take a right decision at the right time. Consult your doctor, consult your physiotherapist also, because this is going to help you and create a miracle in your life. Physiotherapy, just like a miracle in your life, just like if you have belief on yoga system and some other preventive measures. So similarly, physiotherapy is going to be a way of life in future. We all need to understand. We all need to understand the power and its utility also. So let us be always connected, and we are fortunate that Garima is here, and Garima is always ready to help us in whatever best possible way she can. So again, we are very, very proud to say that today's session by Dr. Garima, it's memorable, and we all have learned a lot. TEDx Kanke is keen, TEDx Kanke is proud, and TEDx Kanke is just doing a small thing for the community so that everyone will be benefited. Thanks to everyone from my core of heart, my all team members, those who have done a great part to make it successful. So thanks everyone. Thanks Garima once again from core of my heart, and the whole team is indebted to you. Thank you.
Thank you, Rajiv, and thank you entire TEDx team and TEDx Kanke for giving me this opportunity. I thank all my mentors, my family, and all those who have supported me through this journey and will always will. Thank you for being there and for being around to support me.
Thank you. Thank you.